The third and last of the structural classifications of joints are the synovial joints. These are the most common as well as the most complex of the structural classifications of joints. A key characteristic of synovial joints is the presence of a joint cavity, which is typically filled with a lubricating fluid. The joint itself is composed of a joint capsule that surrounds the ends of the two bones at that particular joint. And the bones within the cavity are not directly connected, which allows them much greater mobility. The fibrous and the cartilaginous joints lacked a joint cavity completely, and so that's why we saw much more limited mobility in those joints. All synovial joints are functionally classified as diarthroses because they are considered freely movable. We'll see later that some synovial joints are more mobile than others, but even the least mobile of the synovial joints still allows more movement than the cartilaginous joints or the fibrous joints. The synovial joints are typically named for the bones or the structures on those bones that are united within the joint capsule. So for example, the glenohumeral joint is the synovial joint that's found at the shoulder. So it's named for two structures, the glenoid fossa that's on the scapula, and then the second part of the name refers to the humerus. The knee joint, as another example, is called the tibiofemoral joint because it's named for the two bones that are united, the tibia and the femur. The synovial joint capsule, which is also called the articular capsule, is composed of two layers, the joint capsule layer and then the synovial membrane. The joint capsule is typically composed of a dense irregular connective tissue, while the synovial membrane secretes the synovial fluid that will fill the joint cavity. Typically, we also see that there are reinforcing ligaments that surround and support the joint capsule. These ligaments are technically not part of the synovial joint capsule itself, but instead they help to reinforce the joint from the exterior. The ligaments, just like other ligaments in the body, are composed of dense regular connective tissue. Other structures that provide excellent reinforcement to synovial joints are the muscles and their tendons that cross the joints. So although there are no muscles pictured in this diagram, synovial joints in the body typically have many muscles as well as the tendons of those muscles that cross over them. Synovial fluid is mostly water, but it has a viscous or thick, kind of egg white-like consistency due to the presence of a substance called hyaluronic acid. And this fluid, that is the joint fluid, becomes thinner when the joints warm up during movement or activity. The thin layers of hyaline cartilage that are present within the synovial joint are called articular cartilage because they cover the ends of the bones within that joint. These thin layers of cartilage help to absorb compressive forces that are placed on the joint, and also helps to provide a smooth surface that allows the bones to glide over one another during joint motion. So notice that the articular cartilage does not actually unite the bones together. Instead, it's the joint capsule that's actually providing the structure that's uniting these two bones together. So what is not shown in the previous diagram are the many sensory nerve fibers that are called joint kinesthetic receptors that occupy the fibrous capsule. So most of these sensory nerve fibers detect joint position as well as joint stretch, and this information is used by the brain to coordinate body movements. But a few of them also detect painful stimuli at the joint, so when the joints are overstretched. This diagram also more clearly highlights the structures that belong to the joint capsule, which are the fibrous capsule as well as the synovial membrane. Now, a couple of synovial joints in the body have fibrocartilage structures that are located between the bones in order to help reinforce that particular joint. If the fibrocartilage pad is oval-shaped, it's called an articular disc, and if that fibrocartilage pad is C-shaped, it's called a meniscus. So one such example of a meniscus is the medial meniscus and the lateral meniscus that are found in the knee joint. Here, the meniscus act to absorb shock, and they also help to keep the femur bone aligned with the tibia at the knee joint, so that way the femur doesn't slide forward on the tibia during movement. Other structures such as bursa and tendon sheaths are also located at synovial joints, although they are located externally to the synovial joint cavity or capsule. And these structures serve to reduce friction between the muscles, the tendons, or the skin that are superficial to these joints. The bursa and tendon sheaths are structures that very much resemble synovial joints in that they have these sac-like structures and are filled with synovial fluid. They both function as bearings to reduce friction as bones or tendons or skin move across that particular synovial joint. The bursa reduce friction by separating adjacent structures, as I've mentioned previously, things like skin, ligaments, muscles, or tendons near a synovial joint, which will prevent those structures from rubbing directly against one another. Tendon sheaths are named because they are wrapped around tendons at places where the tendon will cross a synovial joint, and so it helps to reduce damage of that tendon during joint movement, and also helps to reduce friction and ease movement as that joint moves as well.